Hello guys, welcome back to my YouTube channel. Hope you've liked, subscribe and share my videos, and hope you're liking what I'm doing here. Alright, my name is Frances. If you're meeting me for the first time, I talk about OSCE and nursing. So today we'll be talking about insertion of nasogastric tube. So you can call it fine bore NG tube insertion. So it takes 12 minutes. What will you be needing for this procedure? You'll be needing this stick bowl. That's in case if your patient wants to throw up, your oxygen, suctioning machine, alcohol gel, that's your hand sanitizer. You'll be needing hand glove and apron. You'll be needing 50 ml syringe. And of course, you'll be needing your plaster and your nasogastric tube. All right, guys, it's very simple. Very simple. Just stay tuned and listen. Okay, so I'm going to approach my scene. I approach my scene. I see my scene is safe to approach. Nothing to trip me or fall. It's hazard free. I'm happy to proceed. I'll draw the curtain to provide privacy and dignity for my patient. I'll do my hand hygiene according to WHO guidelines. Put an ampoule of alcohol gel on my palm. Rub my hand palm to palm. Right hand over left dozen with fingers interlaced and vice versa. Palm to palm with fingers interlaced, fingers interlocked, fingers interlocked. Rotational rubbing of the thumb, rotational rubbing of the thumb, tips of the fingers, and the wrist. I allow my hand to dry for 30 seconds and I'm happy to proceed. Hello, my name is Frances. Please, can I know your full name, please?
My name is Emmanuel James.
All right, Emmanuel James. What's your preferred name?
Emmanuel.
All right, Emmanuel. So I'm here today to carry out a procedure known as insertion of nasogastric tube. Okay. So please can I confirm your name with my paperwork, with the paperwork on my hand, to be sure I have the right patient. Are you happy for me to do that?
Yes.
All right. So I have here Emmanuel James. Emmanuel James. Date of birth, 1st of the 1st, 1950, 1st of the 1st, 1950, NHS number 1234, NHS number 1234. So make sure you do your three-way ID check. You ask the patient, you check your paperwork, and you look at the wristband on the patient's hand, okay? So I'm here today, just like I told you, to carry out a procedure known as NG tube insertion. The dietitians has prescribed this procedure for you. So that it can help to meet up with your nutritional requirements, both your food and fluid intake. Okay, so it's going to take 12 minutes of your time. I assure you it's a discomforting procedure, but you'll be fine. Okay, are you happy for me to continue?
Yes.
All right, so you'll be sitting in a semi-upright position with a pillow at the back of your head so that your head will not tilt forward or backward. All right, so I'm going to be arranging a signal with you during this procedure. If you are feeling any form of discomfort at all, you raise up your hand and give me a signal for me to stop. Is that okay by you?
Yes.
All right, so you'll be doing a sniff test for me as well during the procedure. All right, so if you're happy for us to continue, I'll drop the call bell with you while I go back to get my equipment ready. Is that okay by you?
Yes.
All right, so I'll gel my hand. Remember, I'm leaving the patient. So guys, I'm going to validate my equipment now. So I have my NG tube here. So it's valid, is in date. I'm happy to use it. I have the stick bowl, is neat, it has not been used. I'm happy to use it. I have my 50 ml syringe, is intact, in date. I'm happy to use it. I have my hand glove, I have my apron, I have my alcohol gel. Of course, the oxygen machine, the oxygen and the suctioning machine should be there. Okay, so I'll put on my apron. I'll put on my hand glove. So I'll take my equipment to the patient. Hello, Jeff. Hello, Emmanuel. I'm back, okay?
All right.
Okay. So just like I've repositioned you to semi-upright position, so I'm ready for the procedure now, okay? So I'll advise you now to do a sniffing test for me. You hold your left nose, you sniff the other nose, then you hold your right nose, sniff your left nose, then hold your left nose and sniff through the right nostrils. Are you okay to do that?
Yes.
All right. So I can see there is no obvious obstruction. There is no obstruction in your nose. Okay. All right. So I'm going to be doing the next measurement now. I'll get the NG tube. Guys, this is an improvise. I'll get the NG tube. I'll measure from the bridge of the nose to the ear lobe and to the Zinfid sternum. It is called next measurement, N-E-X, next measurement. So I'm going to measure now from the bridge of the nose to the ear lobe, from the ear lobe to the Zinfid sternum. Then I will note my measurements. So let me assume it's 50 centimeters. Then I'll be adding extra 5 to 10 centimeters. Don't worry, guys. If you don't add it, it's not a fail. Okay? So I'm going to add like 5 centimeters to my measurement, which is making it 55 centimeters. Then I'll get my water, that's the warm water. I'll lubricate 15 to 20 centimeters of the proximal point of the NG tube. So when I lubricate it, I will now start inserting in a backward inward manner. Okay, so I'll start inserting the tube, making sure that my patient is not in any form of distress. Maybe the patient is coughing or in any form of breathlessness, I will stop. I will take it off and stop. Okay, so and I'll also make sure that I'm asking the patient how the patient is feeling. All right, Emmanuel, I'm going to be inserting this tube now. So I'll insert the tube into the nostrils. All right, Emmanuel. So when you feel this tube at the back of your throat, you start swallowing for me if you can, okay? So I'll keep on advancing the tube. I'll keep on advancing the tube in a backward inward manner to pass through the floor of the nasopharynx, then to the back of the throat. All right, Emmanuel, please, can you swallow for me, please? All right, that's fine. Okay, so I'll note the measurement I have taken, which is 55. So once I get to the bridge of the nose and to the measurement I've taken, I'll stop. Okay, so make sure you give the patient the sick bowl. Don't forget, keep the sick bowl for the patient in case if the patient wants to throw up. All right, Emmanuel, are you okay?
Yes.
All right, that's fine. So I'm going to be getting the plaster now to put the tube in place. I'll put the tube in place. Then I'll get my 50 ml syringe. Normally in the exam, your examiner will get the gastric contents ready for you in the tube or in a container. Then you have your testing strip, the pH indicator strip. It will be there for you to use as well. So for you to measure, after doing that, you get the 50 ml syringe, take small amounts. Okay, you take small amounts from the tube. You open the integral parts. You take small amount from the tube, then do the measurement. So normally it's supposed to be 5.5 or less than 5.5, okay, which is showing that it's acidic and is in the gastric, is in the stomach. Okay, so that's a good indicator that you've inserted the tube appropriately. Okay, so after doing that now, then I will take off my syringe, do the testing, or take off my syringe, close the integral part of the tube. Okay, then after doing that, I'll go and do the testing to be sure I have it in place. Okay, guys, so make sure you take off this. Of course, your oxygen machine is there, your suctioning machine is there, and this patient is not in any obvious distress. So I'm okay. I don't want to use the suction machine or the oxygen machine. Okay, Emmanuel. All right. So I'll advise you, before anything is given to you, maybe food or fluid, we need to check if this tube is in position by doing what? Repeating this test by using the pH indicator strip to check. Okay, all right. So if you feel any form of discomfort, any form of, maybe if you're not okay at all, you let us know. Okay, all right. So I'll allow you now. I'll make sure I document my whatever I've done today. I'll document it in the nurse's notes, then report my findings, then take off the used equipment, dispose in the clinical waste, then take off my apron and my hand glove. Dispose this in the clinical waste. I'll gel my hand, palm to palm. Right hand over left dozen with fingers interlaced and vice versa. Palm to palm with fingers interlaced, fingers interlocked, fingers interlocked. rotational rubbing of the thumb, rotational rubbing of the thumb, tips of the finger, and the wrist. So guys, I will tell you the tips to pass this exam. So make sure you leave your patient professionally. Just like I finish the procedure, I'll say, okay, all right, Emmanuel, I'll make sure my patient is comfortable. So I'll be leaving you now, but I'll be around to check on you if there is anything at all. But I'll drop this call bell with you. If there's any problem, please ring me. I'll come and check on you, okay? All right, thank you. Then you do your hand hygiene. Okay, so the tips here now is that you must do the sniffing test. Make sure you do the sniffing test. Make sure you position your patient in a semi-upright position. Make sure you arrange a signal with this patient. It is very important. Then your oxygen machine, your suctioning machine should be there. Of course, if this patient is in any form of distress, you need to use all those equipments. Okay, guys, please subscribe, like, and share. Hope you like what I'm doing here. All right, thank you. I'll see you in my next video, guys. Thank you. Bye.